Hello everyone, my name is Philip Samuel, Care and Support for Community Health Initiative for Youth in Nigeria. The work I do as Care and Support for Community Health Initiative in Youth in Nigeria, I do counseling, counsel clients, our positive clients, both PrEP and the positive clients, to assess their readiness to start the long therapy, which is ART. And after doing that, when the client is ready, before we place them on ART. So far so good. We were able to meet total positive 3,119. Out of 3,119, we were able to collect total sample 619, which MSM were 527, while TG were 89, and OKP were 3. OKP means other key populations partners. So out of that total number collected, this sample were collected, we have total of 619. Also, we have total of unsuppressed 38, MSM 34, while TG were 4. So with the help of this project, EPIC, I'm saying a very big thank you. So far so good. We were able to have this huge number because of the hard work that both my team has put in place and your support. FY20, USAID, PEFA, I want to say a very big thank you to all of you for all this great work that has been put together. We hope all this good relationship continue in FY21. Thank you very much.
Good day everyone, I'm Moses Peter Sani. I'm the OSS record clerk, which means I'm the one-stop shop record officer of Community Healthcare Initiative for Youth in Nigeria. And I'm also the online focal person of CHIYN. Basically, what we do at the record office, we keep record of all our clients' information, which includes their viral load results. We are in charge of their PrEP cards, and for the positive clients, all their ART care card is under our care. And also, I'm in charge of ensuring that clients meet up to their appointments as when due. So at every month I ensure that every client's refill date is being fixed, and also they are being contacted for their treatment. And so far so good. We've treated about 3,119 clients on ART, and also we've treated over 4,000 clients on PrEP. And so with these huge achievements, I want to say thank you to USAID, thank you to PEFA, and thank you to EPIC for giving us this opportunity to come out to show our own support to the community by helping to combat this great virus, which is the HIV and AIDS, and also by helping to see that those who are negative remain negative through the PrEP intervention. Thank you.
Hello viewers, my name is FY20 George, and I am the pharmacist for CHIYN, also known as Pharmastress. I work with Community Health Initiative for Youth in Nigeria here in Niger State, which is a non-governmental organization that is aimed at working with key populations here in Niger State to provide health care services such as HIV testing, STI screening, tuberculosis prevention services, and other gender-based violent cases and other etc. Psychosocial support system also. CHIYN as an organization has actually penetrated so much in Niger State that we're actually covering 10 local governments in Niger State. I don't need to mention, but I'll mention a few. We are covering Suleja, we are covering Chanchaga, we are covering Boso, we are covering as far as 5-hour trip down to Kotangora, that of Bida and Mokwa. We are also covering Gurara and Tafa. So reaching all these places, you must know that we have lots of field workers that are actually penetrating into this local government and having us getting case findings. And I would probably to say that some of our success story as a CHIYN staff and some of our success story in general, like our achievements so far, we've been able to find out as 3,743 reactive cases within this 10 local government. That's a big one, right? Yes, that is the work of CHIYN as one, as a team. And also we've been able to also on this line cover so many people who are actually negative on HIV testing, and we have covered over 4,167 clients that are actually on our prevention services right now, and we have been following them up. We have not gotten any backlog on loss to follow up or any sort, and we can't do this alone, but as a group, as one family. And then I am in charge of the pharmaceutical dispensing of drugs here, everything that has to do with inventory, how the drugs come into the OSS, which is the one-stop shop, and how it leaves the clinic, how it gets to the final consumer, which is our client. That is what I do as a pharmacist here, and we make sure that every referrals that we are actually referring these clients out to, like those who go out for other services we don't offer, we refer them to other organizations. So with this, you know that CHIYN has actually come to actually make the key populations here in Niger State to receive free healthcare services without stress. Alright, I want to give a very big thank you to EPIC for bringing this project to Niger State. Of course, I won't be forgetting our donors, USAID and PEPFAR, who has been the one behind this project, who have been anything that has to do with fund, sending it down for this project to be a success. Definitely, I will also thank FY20 for their overwhelming assistance in this EPIC project, and of course our state's supervisors, which is in no other name Annie, who have been there supervising and making sure that we actually come to a success in this project so far. Thank you very much, thank you very much EPIC for bringing the services, these free services to Niger State. Thank you.
Good day everyone, my name is Nora Shizifren. I'm the lab focal person for CHIYN, Community Health Initiative for Youth in Nigeria. Basically, my work in the lab here, I do sample collections, that's the viral load collections. I do the routine analysis for PrEP. I also on the whole, I also run hepatitis B, hepatitis C, syphilis, just on our clients who feel or who prefer coming into the facility to access care. Okay. Basically from May down to September 2020, I have collected a huge number of about 619 samples, in which those 619 samples were able to receive results of 506 in total, and then from that 506 we're able to receive 468 results which were all suppressed, and then 38 results came unsuppressed. At later on, we're able to collect, still in the month of that September, we're able to collect 8 samples from those 38 clients who were unsuppressed, and to God be the glory, we are still expecting their results. And though 3 results later came in, and 2 were suppressed and 1 was unsuppressed, and we are still working on them, and we believe the one that was unsuppressed will definitely get his or her suppression, and ascertaining U equals to U, undetectable, untransmittable. Okay, I want to thank CHIYN as an organization, and I also want to thank our noble director of this organization, Mr. Bethel, for the golden opportunity, for entrusting this huge task on me. And I also want to thank our funders for the confidence and the trust they also have on me for giving me this position to work as a lab focal person. I want to say a big thank you once again to you, Said, to PEFA, and to Epic. God bless you all. One love.
Good evening. Thank you. You're welcome. I'm Dr. Ozo Delanos, working with Community Health Initiative for Youth in Nigeria under EPIC project. The community, the CHIYN abbreviation, and the facility is located here in Niger State, precisely in Minna, the state capital. Our targets are the basically on key populations, vis-a-vis the female sex workers, MSM, that's men, sex men, TG, the transgenders. And the services we render to them are mostly HIV infections, sexually transmitted infections, and this is more on the key populations. This is the reason behind it is that they don't usually have attention from other medical officers or medical doctors in the general population. So as a result of this, the EPIC project decided to work on it for the health of the key populations. So, and though when we came here newly, it was not an easy task, but with the help of advocacy visits to the stakeholders, communities, and the forces, and so many others, we were able to be meeting up with our targets. So our achievements and our plan is to make sure that people living on HIV, with HIV, are virally suppressed. People that are not HIV reactive, they place them on PrEP, pre-exposure prophylaxis, to prevent them from getting infection. And people with STI, sexually transmitted infections, we equally place them on drugs, since they find it difficult going to the general population due to the kind of treatment that that is meted on them. So we're able to, so far so good, based on our statistics, we're able to, based on the statistics, we're able to, the number of people that enrolled into treatment, from the results, their viral loads were suppressed, and many people are turning up because of there's positive effect on the treatments. And what doctor likes most of the time is if he sees a client, a patient, if a working client comes in, and after the treatment, during the follow-up, if the person comes back with better treatment, if the client reports that is better, and then again from your assessment you'll be able to discover that the client is doing better, it gives the doctor joy. So as a result of from these parameters, I've seen that many of our clients are better. Even some investigations carried out, their viral load were suppressed. So, and they are coming on daily basis to collect their drug. So, depending on their appointment days. Okay, I'm thanking EPIC, PEFA, FY20, and all the funders taking them for their support and care.
My name is Uche Success. I'm the MSM Program Officer for Community Health Initiative for Youth in Nigeria, currently working on EPIC projects and community engagement grants. Okay, our work in Niger State is to meeting targets and controlling epidemic control among the key population. In Niger State, we are covering about 10 local governments, where we reach out to get some MSM, CGs and agenda. Like in my own office as MSM Program Officer, I make sure that all activities that we need to carry out in this project as approved in the budget is being carried out the way it's supposed to be carried out and at the due time. I make sure that the frontline workers working in the field, they follow the standard operating procedure to make sure they're doing what they are supposed to do, the right thing they're supposed to do in the field, by the way they get the reactive, and they make sure that we are involved into care. The positive ones, the negative ones, they tell them about prep. Those ones that want to prep, they share them on prep. Also, there is what we call moonlight. That moonlight activity is the time we used to reach some MSM, high-class MSM. Maybe some of them that are working in the daytime or that don't want to come out in the public for people not to know them. During the moonlight activities, through our stakeholders and gatekeepers, we invite them during the moonlight activity for them to be reached. At that process, we refill clients, we offer ICT during that process. So far, so good in Niger State. Now, through these EPIC projects, we are able to get up to 1,851 MSM on treatment, and also 1,551 MSM who are taking PrEP under this EPIC projects. Through this EPIC project also, we are able to get grants on community engagement, which we have safe house now, where some community members, maybe due to stigma and discrimination, they were chased out of their homes. We were able to recruit them and screen them and give them a safe home where they will be staying for a while. And during their stay at the safe house, they will acquire some skills that will help them. After the project, they will be able to stand on their own. And also, we have paralegals on that community engagement grants. People that screen, they go around the local government to screen people on gender, to screen them. Those people that have gender case, they will make sure that they are screened and they link them to our human rights lawyer to follow these cases up. For me to cut it short at this junction, I would like to thank EPIC, I would like to thank PEFA, I would like to thank USAID, people that have brought this project to Niger State. For a while now, for years now, there is no intervention for key population in Niger State. But through this project, we are able, key population in Niger State, we are able to reach with this HIV treatment and others. Thank you.
Okay, my name is Dejibelo. I'm the gender focal person stroke the ICT focal person for Community Health Initiative for Youth in Nigeria. Working on the EPIC and community engagement projects, which the EPIC is maintaining and meeting target for epidemic control, and which the community engagement is to reduce the impact of gender-based violence among the key population, and also the safety and security and human rights violation of the key population in Niger State. And EPIC has been a wonderful project that we've been working on for going to 2 years now. And working as the gender focal person for the organization, which is my main primary job, is to work as the gender mainstream advisor to the organization, which will also carry out gender sensitization across the 10 local governments, sensitize the community on the basic fact on gender-based violence, because it has been happening about the community, key population community, about the high rate of gender-based violence among the TGs, which is the transgender community, the MSM, which is the men who have sex with men community, and the FSW, which is female sex workers community. Gender sensitization is an accurate and very standard activity that needs to be carried out every month, which is actually approved in the EPIC project. And we've been carrying out gender sensitization across the 10 local governments in Niger State to sensitize the population about gender-based violence, safety and security among the MSM and TG and the FSW community. We also screen for mental health. We also carry out psychosocial support among the MSM, TG and the FSW. And we also counsel on IPV, which is the intimate partner violence, for those who are scared to disclose their status to their partner due to violence. And we also carry out psychosocial support for all FSW who just got tested and got positive of HIV/AIDS or being enrolled into care. I said earlier, we also do ICT, which is index client tracking. And index client tracking it's an activity and also a strategy for us to meet up to the targets, which has to do with one of our goals of the 95-95 goals, which is the second goal is to identify everybody who are positive and enroll them into care. And one of the strategies we use in identify all the whole key population who are being positive and to enroll them into care is ICT, which is the index client tracking. We also carry out index client tracking with the MSM community, the TG community, which is the transgender community, and the FSW community. Okay, index client tracking has been a very great strategy for us to achieve some of the positive clients who enroll into care on the EPIC project. It has been a great idea for us, having an original index on the EPIC project, which is initiated into care, which elicited some of his partner and follow up some of his partner up with different kind of strategy, which has to do with passive notification or provide assisted notification. It depends which of the strategies that works faster for us. Elicited, reached to the other clients, which has to do with sexual partner of the original index elicited, and from there we got tracking, tested, get in touch to the index clients. It's either positive or negative. If you're positive, you get enrolled into care, and if you're negative and you're eligible for PrEP, you get enrolled into PrEP. Okay, I want to thank the Family Health International 360, which is the FHI 360. I also want to thank the PEPFAR, the USAID for giving us this opportunity for us to come to Niger State to intervene into the high epidemic of HIV, and also to give us the trends to control the high epidemic of HIV in Niger State, and also giving us an opportunity to write an RFA, which is the request for application for community engagement grant, giving us that opportunity to participate in the community engagement grant, which objective has to do with safety and security, human rights, gender-based violence, safe home for homeless, transgender, MSM and FSW. It's a great pleasure working with PEPFAR and USAID. Thank you.
Okay, my name is Ashegun Samuel. I'm currently the Senior Program Officer in Community Health Initiative for Youth in Nigeria. Community Health Initiative for Youth in Nigeria, popularly known as CHIYN, is implementing the same project tagged EPIC KPIF, which is concentrating on epidemic control for key population in Nigeria. So our office is located in Niger State. Our head office is in Mina. So my duty as the Senior Program Officer is to ensure that the project is well sustained, the successful implementation of the project, and to ensure that the data collected, everything is in order and is well harmonized, and then to liaise with the state team to ensure the proper running of the OSS. So far so good, we'll be doing so well, and reaching the key population it's friendly, and then we've done so well in terms of with the strategies that we implemented. So far so good. Currently in our system we have over 3,600, close to 3,600 community members on treatment on ALT. Then we have some enrolled on PrEP. Then part of the things we do, we also do services like we try to monitor clients on gender-based violence services. They will provide psychosocial support to community members based on their needs. So far so good. The community members that really they've shown appreciation towards this project that is implemented by USAID. They believe that with this project they are to get better, more, and they've shown appreciation that this project should be implemented in other states in order to reach more key population members. In some way, we appreciate the funder, USAID and PEPFAR, for bringing this project to the Niger State, because through this project, so many key population have been placed on treatment, and we've given them vital hope for future, and they have come to show appreciation, and they believe that with this project, they are to get better, more and more. Thank you.
Hello, my name is John Bishop Chukuma, and I'm the program officer at the Community Health Initiative for Youth in Nigeria, known as CHIYN. And we are working with EPIC. We are working with EPIC to maintain the epidemic control among the key population, as in making sure that the spread of HIV was contained and reduced. So as a program officer, we work through the help of the frontline workers, who we first of all equip and train them to go and meet our target people at the community. From then we can get the number of people that we document everything that they do, all the data that they bring, and we document it and make sure that all the targets are placed, all the people that were supposed to be put on ICT are put on ICT, and all the people that were supposed to record on GBV were recorded on GBV. And so far so good, the record has been successful. Most of them who are finding it very difficult to come out are beginning to come out, because they are seeing people that are like there, and we're able to make sure feel comfortable. And when we talk about GBV, there are so many of them are going through a lot of stigma and discrimination, but through the help of GBV's gender-based sensitization, we were able to hear from them, get help from them, and from them, most of them who were homeless were also provided a safe home through the grant we got from our sponsor, them. From there, a safe home was provided for them, and since then, all of them has been living freely and thanking the whole community for being there for them when nobody was with them. So far so good. We have recorded so many good stories. We are able to reach so many of them who could not even come out and express themselves. So we are able to make them feel at home. So I want to thank USSID and PEPFAR for the opportunity they gave us to work with them. I say thank you.
My name is Kennedy Ngozi Ike, working in Chanchega local government as a councillor tester. So I want to use the opportunity to thank USAID for coming into Niger States for their great work they have been doing in Niger States. At least for a very long time, we have never experienced such in Niger States. First, at least our community members can come to our OSS and access care without any fear, without any trouble, and they will feel happy. Our organization here is like our family home. Even when we are in trouble, we come. If we have any problem, we come. Where we see people like us, we talk to each other, we share our problem and know how to solve it. We thank EPIC for at least bringing such thing like this in Niger States. For a very long time, we have never experienced this. It's a very good one. All thanks to them, we access care without payments. At least it's not an easy thing. So we thank God for bringing them. We thank them for all what they have done, and we pray they will continue doing more. So I thank them so much. I thank EPIC, FSH, all the people that have been supporting this organization. We say they should continue, and God will continue strengthening them. Thank you.
Hello, my name is Emmanuel Mbanifo. I'm the senior M&E person in Community Health Initiative for Youth in Nigeria. Basically what we do here is to supervise and analyze and also evaluate every data that comes into the establishment. So far so good. As an organization, we've reached to over 3,000 plus and counting. of key population people with our HIV prevention services. And CHIYN has been able to achieve this because of the kind of funders and the sponsors that we have. So therefore we are grateful to FY20, to PEPFAR, to USAID for their support and the grant they have been giving to us. We also plead for more grants to come in to enable us to reach out to more people so that we'll be able to cover those grounds that we've watered. We conducted mapping, so we need to go into those places and fetch out more clients, more reactive people, and bring them into care. And the money aspect has always been our challenge, but with their help and support we'll be able to achieve our goal. Thank you.
I'm Clement Uchi, Finance Officer of Community Health Initiative for Youth in Nigeria, here in Mina, Niger State. So we've been carrying out activities for the EPIC project, which is meeting targets and maintaining epidemic control. The project started early this year, which is February 1st, and we've been, we target KPs, mostly the MSM, TGs, and FSW. So in terms of funding, we are being funded by PEPFAR, USAID, and the recipient's organization is FHI, which we are being supervised by Annie here in Mina. So for the past 9 months, we've been giving funds based on our work plan and our fund requests, which is normally done on a monthly basis. And at the end of the month, we provide our financial reports through mails and also hard copy. So CHIYN, that is the abbreviation of Community Health Initiative for Youth in Nigeria. We have our core value, which is accountability and transparency. Because once it comes to funds, you have to give accounts of what the donor normally sends every month. So through this, we get our monthly bank statements so that we can reconcile our cash book, and also there will be indicators of how funds normally leaves the account. So at this junction, I'll see we have we have both the front line workers and staff. CHIYN is paying up to 60 people, which everybody has his or her own role to play. And since the beginning of the project, we've never had any issue of misappropriation of funds or fraud. So at this junction, I will say thank you to EPIC, thank you to USAID, thank you to PEPFAR, and thank you to FHI.
Good day all, I'm Paul Elisha Kuzi. I'm the Administrative Officer of CHIYN, that is Community Health Initiative for Youth in Nigeria. We are implementing the project right now, EPIC, which is for epidemic control and maintaining target. Well, my office as the Administrative Officer is to have the program unit and the implementation of this project to make sure we meet the target and also bring the expected result that is needed and the benefit of the program to the beneficiaries. So far so good. With the help of my office, we've been able to achieve a treatment record of 3,741 persons so far, and out of this we've been able to offer this treatment to 851 MSM, and 338 TG. And for the FSW, we've been able to reach out to 1,476, and the OKP men, we've reached out to 61%, and the OKP female, we've reached out to 15%. All this is done using very good strategies targeted at meeting these people at the right time. Example, we use the moonlight testing, where we organize an activity and then people come from the party and the enjoyment and every other thing. We then do the testing and get results, and also make sure these people are enrolled for treatment. For me, I would say EPIC has been a success because we've actually reached out to a quite number of persons. We know there are still more, but then for the ones we've reached, we are glad and we are happy that we've actually touched their lives through EPIC. And they also are glad because we have come and we've been giving these services to them. One of the services we render is the HIV service and that of STI services as well, which we offer to every population. But our main focus is the key population. But whoever comes to us for these services, we give them free of charge, because this is what we are here for, to meet target and maintain epidemic control of AIDS, including STI, in the community. And my experience so far in EPIC has been awesome, I must say. I'm really glad I joined the EPIC team, and I'm into this team working for the betterment of humanity. I would want to say that you who are out there, you can partner with us in whatever capacity you deem fit, and we'll be so glad to receive such partnership from you. Thank you very much. I still remain Paul Elisha Kuze.
Okay, I'm Victor Kalu by name, popularly known as Cindy Pebbles, and the TG Program Officer for Community Health Initiative for Youth in Nigeria, that's CHIYN. And due to, for the grace of EPIC project in CHIYN, which is in Niger State of Nigeria, in the northern state of Nigeria, that's Mina to be precisely, we have been able to meet a lot of transgender people through HTS, and those of them that are reactive, those that are reactive, we place them into ART, that's antiretroviral therapy, and those that are negative, we place them into PrEP, which is pre-exposure prophylaxis. And everywhere is that we normally used to have our TG meetings. And thanks to EPIC project, finally we got our safe house here in Niger State for the transgender people and the MSM people who were disowned by their parents, and also who were disowned by the community, chased out of the community for expressing themselves and for being who they ought to be. So the safe house alone provides a lot of shelter for them. Me myself, I'm a living witness. Before I became a program officer for Community Health Initiative for Youth in Nigeria, that is CHIYN, I was once chased out of the house, but for the grace of the ED of CHIYN, the executive director of CHIYN, he gave me a lot of shelter. That is my own success story, that I have to let go of my past and move on to the future. And that is the same way the transgender communities are doing. The ones that we have reached a lot through HTS. And come to talk of Moonlight. Yeah, our community will love parties. So through Moonlight testing, we meet the hard-to-reach transgender people, those that are hiding behind the closet.
So through the moonlight testing, once they hear there's a party, they will, through the moonlight testing, we get to meet them. And come to talk of GBV aspect. Through our TG meetings every Wednesday that we used to do, through that platform we used to share our success stories and our challenges living as transgender person in Nigeria, because it's not easy living as a transgender person in Nigeria anyway. So we used to share our stories and we used to share our challenges about our living as a transgender person in Nigeria. Though it has not been easy living as a transgender person in Nigeria, but because of the meeting, most of them has been coming out. Most hiding TGs, most high-profile TGs, that is when they get to come out of their closets. We discuss about our sexual life, our GBV cases. That just like last week, one of us have a GBV case that she was nearly raped on her way going back home from a friend's house, but due to CHIYN intervention, CHIYN make sure that everything went to, the case went to judgment as according as it's supposed to be, from their paralegal officers to the gender focal officer. Then we are very much happy. Let me just say that we are very much happy. My people are very much happy. But my transgender people, since CHIYN came to Niger State, they have been very much happy that because before they were hiding in behind the shadows, wondering when are we going to be free? When are we going to have this freedom of expression? But since CHIYN came to Niger State of Nigeria, we have been having this freedom, and most especially the TG meetings and the safe house for those that they were disowned from their parents and they were disowned from their, banished from the community because of they were trying to express themselves to be who they are ought to be who they feel inside. So they feel so much happy and they thank the EPIC project for coming into Niger State, because without EPIC project, they would have been into closet till now. Thank you so much, EPIC project.
I got to know about my HIV status February this year, and I felt as if life was completely out of me. I felt as if I am the only person that has this kind of disease. And when I got tested, I was told I was HIV positive. I felt as if I would just go home, lie on the bed and die. But with a series of talk from health workers that work with KPI of the EPIC project, they made me to understand the counselors that being HIV positive is not the end of the road for me. That me being HIV positive is not a death warrant. That as I'm HIV positive, there is a medication that when I take, it will manage this HIV in my body and make me look even healthier than people that are HIV negative. I came to what he told me, I enrolled, and I started taking my medication religiously every day. And right now I am proud to tell myself that I am undetected, I am virally suppressed, and nobody will know that I was HIV positive before. I was afraid to actually open up and tell people about my HIV status because I felt the stigma and discrimination that people will actually bestow on me, the family and friends. I actually told a friend of mine that I was HIV positive, and this person ran away and went and told other people about my HIV status. I felt as if that was the end of the road for me. But getting to talk to the counselor, he told me and even suggest some of the healthy tips that I would use, that even though I am HIV positive, nobody will know that I am HIV positive. I am so happy today that as being an HIV positive patient, I am taking my medication, I am virally suppressed, and I want to tell those people out there that are afraid to get tested for HIV that go and know your HIV test status today, because HIV is not a death warrant for you. HIV is not the end of the road for you. So go know your HIV status. If you're positive, please enroll on ART. If you're negative, take PrEP. That will be good for you. Thank you so much. I want to use this opportunity to say a very big thank you to all the funders for HIV prevention and intervention. I want to say a very big thank you to EPIC Project. I want to say a very big thank you to Annie. I want to say a very big thank you to USAID. I want to say a very big thank you to FY20 for making us realize our HIV status and providing those services that we need as key populations in the community. We felt as if nobody will reach out to us because we are key populations and we've been abandoned in this country due to the stigma and discrimination that has been on the key populations. But thank God for the USAID, FY20, Annie, and the rest of the organizations for putting hands together to bring this prevention and intervention for us once again. I say thank you so much.
I'll use this privilege to thank the Executive Director of Community Health Initiative for Youth in Nigeria, Onyedi Kashigote. He has been a father to us. He has been at our back, assist us when we don't have money to eat, then take our drugs, and use also the opportunity to thank PEFA, CCRH, USAID, Annie, and FY20 that impact so much in my life, and now it's me now giving back to the world for me to impact to them, let them know that being an HIV positive is not the end of the world. They can still live, they can still get married, they can have their kids once they adhere to the drugs and they live fine. They live, thank you.
Hi, I'm Bettelene Kachi by name, the Executive Director of Community Health Initiative for Youth in Nigeria. Community Health Initiative for Youth in Nigeria is an LGBTIQ-led organization. What is the vision of this great organization? In Nigeria, where every youth and other vulnerable population will have access to quality and comprehensive health care services free from all forms of stigma and discrimination on the age, sex, gender, socio-economic status, orientation, and HIV status. What is our mission? To lead the provision of effective and sustainable intervention to address physical, psychological, economic impact of HIV and AIDS among key population and other vulnerable population through information sharing, peer education, advocacy, capacity building, economic empowerment, and psychological support. What are the main activities we do? Capacity building in the areas of sexual and human rights for the most at-risk person, center-based counseling, periodic outreach to communities, constituency services on sexuality, gender, and human rights issues. CHIYN as an organization started implementation in Niger State in the month of February on a project called EPIC. What is EPIC? Meeting target and maintaining epidemic control in Nigeria. EPIC has, CHIYN as an organization started implementing EPIC project in the month of February. And since February 2020 till date, it has been so wonderful from glory to glory. CHIYN as an organization were able to place 3,741 key population on treatment. Out of the 3,741 key population, MSM were 1,851, TG were 338, FSW 1,476, OKP male 61, OKP female 15. What are the strategies that work out for us in EPIC? Moonlight testing, ICT, IPC, support group. What are the things we do in EPIC? Now, EPIC also help us in setting up a beautiful support group where all members of people living with HIV gathered monthly for them to discuss their challenges, way forward, and also for them to know that they are not alone. In EPIC project, we also do what is called PrEP, because when we tested you and you are negative, we don't need to leave you to go like that. We'll also place you on what we call PrEP. PrEP is the HIV negative drugs. PrEP is the HIV drugs meant for HIV negative person.
And in EPIC as well, we also do STI screening and treatment. EPIC also support in treating our key population that has STI challenging issue. In EPIC as well, we also do hepatitis B screening and hepatitis B and C screening. We also do psychological support. And in EPIC as well, we were able to cover 10 local governments in Niger State, and whereby we all strongly believe that before the project ends, we will also go far in reaching other local governments in Niger State. So far so good, because of the good work CHIYN as an organization have been doing in Niger State, we were able to get a second contract called Community Engagement Grant. What is Community Engagement Grant all about? It's a structural project. Community Engagement Grant comes into Niger State or to CHIYN. EPIC awarded this grant to CHIYN to help us address some barriers, some of the things that are the barriers that key population are facing in assessing treatment. What are these barriers? When we have not started our community engagement grant, you will see some of our frontline workers in their local government at where they work. Police raid them, local vigilantes disturb our activities in the field. Even in our offices here, it doesn't stop. They also raid us. But this community engagement grant will help us address all these issues by involving the law enforcement agency, involving the state actors, for them to understand that the key population are human and we are here to stay. As well, community engagement grant also help us support what we call shelter, a safe house. What is this safe house all about? It's for the homeless, MSM and the TG persons in Niger State. Some of the community members, they face this issue of discrimination, stigma, even from their family, whereby some of them, they will be sent out from their parents at the tender age. Instead of them to cause nuisance in the community, we bring them into the shelter house. And in shelter house, what do? We do something like skills acquisition, economic empowerment. Some of them that we think they are good in what we are doing. We train them as counselor testers, community facilitators, peer navigators. We make sure that they equipped, they acquired what skill or that before we push them back to the mainstream society. At least when they go back there, they can start life on their own without depending on anybody. I want to use this medium to thank PEFA, USAID, EPIC. I won't forget our beautiful supporter, that is Annie, CCRS, and also our lovely community members, the key population in Niger State, because without us, there will be no us. Together we are stronger. Thank you.